Good morning, Enid. Thank you for joining us here on this Thursday, February 9th, and staying with us. And as I mentioned, doctor's in the house. Dr. Jill Vilaythong is back with us. She also does a medical moment for us here on the Enid Television Network, and her specialty is internal medicine. What did you think of that school menu?
It looked good.
Oh, really? Okay. I didn't know if it would pass the test or not. We're talking about heart health, and Jill, thank you for joining us this morning. As internal medicine physician, what do you focus on when people come to see you for treatments and so forth? What kind of problems are they having, and what problems do you solve for them, I guess?
Well, thanks for having me here.
Yeah.
As an internal medicine physician, I'm a primary care physician, so I focus on preventative disease, preventative medicine. So we screen for cholesterol, diabetes, hypertension. We also discuss and give vaccinations to prevent the infectious diseases. I also focus on chronic disease management, and so a variety of things.
And now, in 2016, the American Health Rankings annual report had Oklahoma 46 out of 50 states, which overall health ranking. What do you see contributing to that ranking?
It's a very unfortunate but realistic statistic, unfortunately Oklahoma has poor health because we have a very high rate of obesity. We have still a very high rate of cigarette smoking, a high rate of sedentary lifestyle, poor eating habits, and all of those contribute to diabetes, hypertension, heart disease. And so it's a big issue for the state.
Mm-hmm.
Well, it's not a number that we're proud of, that's for sure, because we kind of like to be number one in some categories, and I think we're number one almost in the other way on this. For internal medicine, what role does exercise play? We hear this all the time. Well, I need to exercise, or I should exercise, I need to eat right, and so forth. But coming from someone with expertise in internal medicine, you will probably tell some patients you might consider some exercise. And what would that be?
You're right. Exercise has many health benefits. It lowers your blood pressure. It can help you keep a healthy weight to prevent obesity, and it can reduce your risk factors for hypertension, diabetes, heart disease. It's also good for your energy level, your mood. So there's a number of health benefits, and so we recommend it. The American Heart Association recommends it as well.
So if you ever get angry, you're saying go out for a 3-mile run, right?
That is a stress reliever.
Yeah.
And so.
Yeah. Now, February has been designated as Heart Health Month. However, regarding internal medicine, do you see any health challenges Oklahomans face?
Certainly, I do. As I mentioned, the obesity, the sedentary lifestyle, cigarette smoking, there's a lot of risk factors that are actually reversible and can help prevent cardiovascular disease, but it is a big problem in the state and as a nation, but particularly Oklahoma.
Dr. Jill Vilaythong from St. Mary's, right?
St. Mary's.
Okay, is joining us at the Roundtable this morning on Good Morning Enid. And Jill, I was looking at an article that said that stroke is the number 5 cause of death in the United States behind cancer and also heart problems. Can you define for us what is a stroke?
Steve, a stroke is when the blood vessels leading to the brain or within the brain get blocked or rupture. And so you have an interruption in the flow of blood, and so the brain cells die because... So
it's brain area only, right?
Brain area,
okay.
Right. So brain cells die because they don't get the oxygen and the nutrients they need. And so the symptoms of a stroke include facial drooping, weakness in one side of the body, in the arms or legs, or slurred speech.
Okay.
Wow, and speaking of heart disease and stroke, but now focusing in women, 1 out of 3 women either die of a heart disease or a stroke. Why women are at higher risk of having a heart attack or a stroke?
There's certainly gender differences between men and women in regards to cardiovascular disease, so particularly heart disease and stroke. One of the reasons, there's multiple reasons, but I think women have different symptoms than men. And so a lot of symptoms can go unrecognized. There's delay in treatment. The typical symptoms for a chest pain for heart disease that you think of in men is that chest pain, the crushing chest pain. Most women don't feel that. They actually say that 1 in 8 women don't have that chest pain. So a lot of times they can have more subtle symptoms like shortness of breath, fatigue, just fast heart rate, things like that. So it can be tricky for a physician and even the patient to recognize that something is wrong.
Wow.
So that's a contributing factor.
So do you recommend that for women, they do a screening every year and just definitely keep checking that blood pressure and just finding out what could be triggering that?
I do. I think women, men and women, but particularly women, should have a primary care physician, get their health maintenance, appropriate age, appropriate screenings, and things like that.
Okay.
And so,
We all have stress in our life, and it seems like when I go see the doctor, like I'm number 47, and I can imagine the doctor is stressed out because I'm number 47 and he's got 47 more to go. How does stress, however you define it, impact our health?
it certainly can impair your health. It
Okay.
can lead to hypertension. It can lead to an increase in cardiovascular risk. When you have stress, you have a surge in certain hormones that can be detrimental to your health, like adrenaline, and that can contribute to a fast heart rate, higher blood pressures. Also, stress can lead to riskier behaviors such as overeating, smoking cigarettes, things like that, drinking alcohol, and those pose risk to your health.
Well, this is Heart Health Month from an internal medicine specialist, if you will. What recommendations do you leave us with today?
Well, I think everyone should talk to their doctor about their own specific risk. Everybody is different, but the things that we've grown up with and what you hear is a healthy diet, good exercise, are the basics of good health, and just education and talking to your doctor.
Very good. Well, thank you for joining us this morning. Our 10 minutes goes so quick, doesn't it?
Thank you for having me.
Dr. Jill Vilaythong from St. Mary's is our special guest at the Roundtable this morning.